Hello dear fans. What is podology? As a special area of modern medicine, podiatry deals with full-fledged medical care of the foot. This professional supervision minimizes the likelihood of serious illness. If the disease has already begun to develop, the podiatrist will help reduce the significance of the consequences and avoid complications. General information about podology. Podology is a science that combines knowledge from the field of surgery and dermatology. Podiatrist specializes in solving a fairly wide range of problems. Among them, ingrown toenail treatment, treatment of diabetic feet, post-traumatic foot massage. Medical procedures in the podiatrist's office will eliminate discomfort and improve the condition of the legs. You should know that a specialist in the field of podology is different from a master of cosmetological manicure. The doctor is receiving an appointment at a medical institution. He carries out the processing of the feet according to the established diagnosis and conducts medical manipulations. A podiatrist is a kind of intermediate link between a manicure specialist and an orthopedist. His field of activity can be described as a medical pedicure. The manipulations performed by the podiatrist cannot be done to the patient in the beauty salon. A visit to a podiatrist's office for prophylaxis will make it possible to avoid referring to a surgeon, orthopedist, and other more serious medical specialists. There is interaction and division of functions between doctors in a number of specialties. If we are talking about the defeat of the feet with a fungus, then the treatment is usually carried out by a dermatologist. If the patient has diabetes mellitus, the endocrinologist monitors the development of the diagnosis diabetic foot. In addition to making the correct diagnosis and prescribing the appropriate treatment for the underlying disease, the patient needs to treat problem feet. This is exactly what the podiatrist does at a specially equipped workplace. It happens that a patient has orthopedic problems. In this case, the podiatrist interacts with the orthopedist. Together, they use devices and treatment that can be manufactured in a factory way or designed according to an individual scheme. Such devices help to stop the development of foot deformities at an early stage of the development of the disease. In most cases, an orthopedist, with the participation of a podiatrist, advises the patient on the choice of comfortable shoes that prevent the appearance of microtraumas. After assessing the condition of the feet, the podologist in many cases can draw reasonable conclusions about the presence of some serious disorders in the patient's body. For example, the presence of calluses that are rigid in their structure usually indicates a serious load on the problem area of the foot. And this may be a direct sign of disorders in the work of the musculoskeletal system. Having received a referral from a podiatrist, the patient can consult with an orthopedist, who will make a more accurate diagnosis and prescribe a competent treatment. If we are talking about fungal lesions of the foot, then in this case, a dermatologist or mycologist conducts an examination and clarification of the diagnosis. However, very often the treatment of the disease falls on the shoulders of the podiatrist. It is he who implements the treatment regimen prescribed by another specialist. Cleaning with special substances, correction of the shape of nails, treatment of cracks, all this is part of the functions of a podiatrist. One of the medical problems that a podiatrist has to deal with is treating an ingrown toenail. Several modern techniques are known that allow you to correct the situation without surgical intervention. Even if we are talking about an advanced and complicated case, the podiatrist can provide the patient with a number of valuable advice on nail care and treatment. What do podologists do? The main activity of the podiatrist is medical foot care. Health center specialists know that prevention of any disease is ultimately much cheaper than treatment. Regular foot care is very important. It gives the specialist the opportunity to identify the signs of an emerging disease at the earliest stage and to provide assistance to the patient. In the podiatrist's office, issues are resolved one way or another related to the foot. Very often, the doctor has to treat cracks or correct ingrown nails. Modern equipment and cosmetology technologies make it possible to do this without painful surgical intervention. One of the most common problems is hyperkeratosis. To solve it, the podiatrist can offer special inserts for the interdigital zones. He will also recommend an effective cosmetic product for foot care, taking into account the nature of the cracks formed, which can be both dry and wet. Big troubles lie in wait for those who suffer from diabetes mellitus. In such patients, at a certain stage of the development of the disease, even a small wound on the foot can become dangerous. Proper foot care is not only a question of aesthetics. Certain diseases of the legs can very well cause serious problems with the spine. Calluses, a podological solution to the problem. One of the most common problems related to the foot is calluses. It happens that patients suffer from this scourge for years, and subsequently even resort to radical measures. Undoubtedly, laser therapy and surgery are effective methods. However, they give only a short-term effect. Some time passes, and the calluses appear again. Corns can cause significant inconvenience to a person. These painful formations often affect very deep layers of the skin, and not just its surface. The podiatrist has a set of tools at his disposal, including special cutters, grinding stones, diamond-coated tools. A special orthosis will help to fix the problem caused by incorrectly fitted shoes. It will protect your toes from unnecessary friction and prevent new calluses from appearing. The podiatrist knows how calluses arise and develop. Usually, the cause of this problem is the reaction of the skin of the foot to excessive stress. To forget about calluses, sometimes it is enough to take measures to properly distribute the load on the feet. If the problem is not too serious, the podiatrist can solve it at the very first appointment. All you need to do is choose the right individual corrective device. In more serious cases, the podiatrist resolves the issue together with the orthopedic doctor. If we are talking about fungal lesions of the foot, then in this case, the examination and specification of the diagnosis is usually carried out by a dermatologist or mycologist. However, very often the treatment of the disease falls on the shoulders of the podiatrist. It is he who implements the treatment regimen prescribed by another specialist. Cleaning with special substances, correction of the shape of nails, treatment of cracks, all this is part of the functions of a podiatrist. After the procedure has been performed under the conditions of a doctor's appointment, the podiatrist can prescribe home care for the foot. This contributes to a more effective restoration of problem areas of the legs. Reasons for contacting a podiatrist. A list of the main problems that require observation by a podiatrist. Congenital pathologies of the structure of the toenails, deformation of toenails, warts, ingrown nail, fungus of the skin of the feet or nails, corns and calluses, thickening of the skin in the area of the foot, arthrosis of the joints, deformation of the toes, painful sensations in the feet. A visit to a podiatrist is indicated for a wide variety of anatomical and functional disorders and changes in the legs. Such changes can be caused by injury, overweight, acute and chronic diseases. Very often, patients do not pay attention to foot problems, which are not particularly disturbing and do not cause anxiety. However, an experienced podiatrist can in a matter of minutes see the foci of possible diseases that require immediate preventive intervention. Contacting a podiatrist should become a routine matter. This approach will save the nerves, time and money that will have to be spent on treatment if the disease is neglected. Often, a simple preparation of legs for the summer season becomes a common reason for contacting a podiatrist. A modern woman really wants to be well-groomed. Others pay attention not only to the condition of the skin of the hands, but also to the legs, including the feet. But a pedicure by itself, even if it is very high quality and expensive, will not solve all problems. If the foot has serious defects, not just a hygienic pedicure is required, but full-fledged medical supervision. Only after manipulations in the podiatrist's office does it make sense to put on an external polish. And, of course, it must be remembered that for some pathologies, a conventional aesthetic pedicure without the use of preliminary medical manipulations can be not only inappropriate, but also dangerous. Thanks for watching.